I think you're probably pretty clear with why we need a health history, okay? We've got to find out what their wellness is, past and present, to make decisions for their treatment. Who wants to go back to the modified pen grasping up on your fulcrum? Okay. It was easy for a while. It was hard at first, but then it was easy. So hopefully we'll make this just as easy, and you'll be knowledgeable on it. But main things we have to figure out, is there anything we could do to harm this patient? Or do we need to send them to a physician to find out? Remember, we're going to be stirring up bacteria in their mouth. There's going to be bleeding if they're involved periodontally. So we want to protect our patient. Okay, so I'm going to skip these questions for now because I want us to get to the meat of this. We may come back to them to show you. Let me skip that question. I may have questions interspersed in here, but we'll see. Rationale, rationale, rationale. Okay, we'll go back here. What a fun lecture this has been. Okay, so we may have health conditions like diabetes that would affect our outcomes. We may wonder why the patient is not healing as quickly as they should heal from our treatment. We have that patient that actually was on warfarin. Luckily, it wasn't under my watch, thank goodness. And then had to go to the emergency room because they were bleeding. He did sue the college. Okay? That was from a dental hygiene student and an instructor, you know, that allowed that to go on. I was here. I wasn't in that clinic. Yay. So anyway, that's why we use the health history. Now, it's a legal document. If you fill it out, you must be legible. It must be in black ink. And because it's a legal document, it is confidential. So we will be interviewing each other with your partner's health history today. You will be reviewing your partner's health history. When you open it up, I don't want you to go, whoa, you have XYZ? Whoa, you're on this med? Whoa, whatever you're going to say whoa to, okay? You are now a dental hygienist, a future dental hygienist. You will look at that health history with professionalism and confidentiality, and you will ask the questions directly so you can get the correct answers to them, okay? And some of the questions are uncomfortable to ask, I'll be honest with you. You just have to learn to ask them. You are a healthcare professional. You're starting to be a healthcare professional. But this is a legal document. Can you go home and tell your boyfriend or your husband about all the fun things you learned at your classmates in clinic today? No. Can you be talking with somebody over lunch about it? No. Okay? This is now private information, and you must treat it that way. There would be nothing worse than you gabbing about some patient's health condition in the grocery store and the patient's standing right behind you. Right? Not a good plan. So it's a legal document, black ink, and legible so we all can read it. Okay? So it helps you to understand your client. As you're interviewing them, you will learn about their concerns and their attitudes, and you will start to establish rapport and a baseline. You'll get to know more about their systemic conditions, what they're eating, what they're taking, and you will have to answer the question as to why. They'll say to you, why do you need to know all this information? Because what I can do in your mouth can impact your total health. Okay? So the whole idea is for us to identify key risk factors that may need special management, pre-medication, orthostatic hypotension, you know, are they going to bleed, prosthetic heart valves. We can infect all of that. So we have to know about them. The idea is to prevent medical emergencies. Okay? That health history will tell you a lot. If a person has fainting spells, you want to know that, and you want to be prepared for it. If a person is diabetic, you want to ask them questions. Did you have breakfast this morning? What was your blood sugar? So you can prepare whether they're going to have some type of medical emergency in your chair. All right. We have a Spanish form available. We have no other language but Spanish. It does have translation below the questions. So you'll be able to, you don't have to speak Spanish. You can still give them the Spanish form. So you have to remember that a patient's health status is dynamic. That's why you have to update the health history every appointment, every single appointment. And you cannot touch your patient until your health history is approved by either a dental hygiene faculty or the dentist. And ultimately, the dentist has to sign it. I think it's a really good idea to find out what drugs they're on prior to them coming in. Who told me in their assessment appointment that their paper that their student had to leave and go look up all the drugs? How long was she gone, Jennifer? Okay. 17 medications. So how far along did she get on her appointment? Nah, that's right. So now it's possible that patient came in as a cancellation. Did that one come in as a cancellation?
I don't think so, but she said she tried to get her to stand her medication before doing the procedure.
Didn't. And that happens. So it's really important because you will take clinic time because you won't be allowed to start your patient until you look up all the medications they're on. Allison. Yeah, when you are starting to schedule patients next semester, you do all that on your own time. Yeah. Yeah. No, if you call them on your cell phone from your home, is that what you're asking? You can do that. You can do that. You just have to keep all that information confidential. You can't be saying, to your mom or dad, oh my gosh, look at this psychotic drug they're on, or whatever. You can interview your client, but you must keep it as confidential as possible. And we'll talk about how you call your clients and everything, because I'm always leery about giving them my cell phone, but most of the students, they text their clients all the time and talk to them, so I don't know what to do about that. But we'll talk about that later. Okay, but it's a good idea if they come in with all those meds that you don't have to take your appointment time too. Okay, so you want to pre-plan. So our interview is really important because we're going to start establishing rapport with the patient. Okay, we're going to keep it confidential. We're going to be professional. That means non-judgmental. You may be able to uncover the patient's demeanor when you're interviewing in the health history, how they are, looking to this appointment, whether they're nervous or not, anything like that. We are going to clarify and validate what they wrote on their health history. And as Kristen told us, any yes answer must be followed up with follow-up questions. And when you fill out the yes answer, and I can't believe I don't have my own health history form, but there is a comment section on the back, so flip over your health history form. On the back, does anybody have anything written on the back of their health history form? Nothing? Good, let me borrow yours. Thank you. I can't believe I didn't bring one. Must have been the excitement of Miss Stabby coming. So any questions that you have for the health history form, you put the number here and you write neatly the answer. So if the person has, and I'm making up something here, if the patient has asthma, what do you think you would ask them? Give me a good follow-up question for asthma. What? Okay, do you use an inhaler? That's really a good one. Asthma is number, I should have that memorized, 25. Okay, so they answered yes to that. So here you write 25, uses an inhaler. Another good follow-up question, when was your last asthmatic attack? 25 years ago. Okay, so, and it's a good idea when they have asthma, we require them to, if they use an inhaler, to bring it with them, and it's in your cubicle, and check to see if it's expired. My own father had to be pre-medicated. I went to clean his teeth one day when he came to visit me here in Kansas, and he said, oh yeah, I have my whatever, he had penicillin or something. I pulled out his bottle to pre-medicate him. It was expired. Dad, He goes, oh, that's all right. Just, I'm like, no. So the famous Dr. Runcer wrote him a new script. He had to delay his cleaning appointment. And he was a dentist. So, don't believe everybody, right? So this is where you write the yes answers. Now today, in our assignment in clinic, there's a piece of paper that you're going to ask your client follow-up questions. You're going to write it on the piece of paper. We're not going to write anything on their health history today. Okay? All right. So that's where your follow-up questions. Now, your follow-up questions on the dental side usually right next to the question. That's the only weird thing about the health history. Okay? So if they had orthodontic treatment, you would write down, how long were you in braces? And you'd say 5 years ago or for 3 years. You would write that next to the question. But everything else on the medical side, you write right back here with an explanation of what the yeses are. You should also follow up on the don't knows, just to make sure that they don't know they have what they need to have. Is that making sense? Pretty simple, right? And we're going to assess the need for referral, or we're going to determine do they need to be pre-medicated before we can clean their teeth, okay? Open-ended questions. You don't want yes and no answers. You want to follow them up. So if you're not getting the information you need, you have to keep rolling with that, okay? So it's kind of reviewing the health history and an interview at the same time when you're going through it, okay? These are very important for us to know about their conditions. If they had their last asthmatic attack when they were 5 years old and they're currently 55, is that going to be a red flag for us on the health history? Probably not. If they had their last asthma attack 2 months ago, probably. So you're also trying to sort out, am I going to have to be doing code, calling 911 in the middle of my appointment? So that's the other idea of why we're trying to do this. Now, don't forget that the information on the health history is the client's interpretation of their conditions, okay? So they're not medical interpretations. They're what they understand about their conditions. Like Ms. Stabby said, some people are on medications and they don't even know why they're taking them. Well, if you had all 2 pages of medications, you may not know why you're taking them. And she's correct. When they're on vitamins, they think all vitamins are great, right? Now they're finding out, for all of us old guys, they're like, you have to have all this calcium. You need to take calcium because your bones are going to fall apart. And so everybody takes piles of calcium. Now they're saying if you take too much calcium, you get kidney stones, and there's all kinds of disaster there. So everything in moderation is what should be done. But some people say, well, it's a vitamin, so it's healthy for me. Every client must have a current health history. What does that mean? Does anybody remember from the reading material? When you have a client that comes in every 6 months and you pick up their health history, when do you have to give them a new health history? Speak up, who's talking? When do we give them a new health history? They're perio maintenance. They come to our clinic all the time. When do they need a new health history? Okay, what part is full? Let me borrow yours again, Carol. What part is full? Okay, this part right here. Once this is full, they need a new health history. How old does the health history have to be before they need a new one? What about this date? 3 years. Somebody read. Hallelujah. 3 years. If you see the date up here and it's more than 3 years old, we'll show you how to put a health history on your appointment scheduling so that they will fill out a health history when they come in, or you can mail it to them. We'll talk about that in appointment planning. Okay? No one can touch a client unless their health history has been approved. You can't do anything. Cannot do anything. You can seat the client and talk to them. How's your day going? Okay? Client signs here. When you do your own health histories, you will sign here. I want you to leave this blank for now, because on dress rehearsal day, then we'll be signing that as a dental hygiene student, okay? If it's a new health history, the doctor will sign here. The doctor does not sign here anymore until you update the health history. Everyone signs over here when we take the blood pressure. And we'll talk about that record keeping on Thursday. The doctor will sign, you will sign, and the patient will sign here. This is where you have a patient, they come in for the assessment appointment, you take their blood pressure and pulse, you checked over their health history, you can write new patient, everybody signs it. Patient comes back to get their scaling, update their health history, any changes in your medication, any changes in your health. You take their blood pressure and pulse, you write no changes, everybody signs it. Patient comes in for their third visit, you date it, any changes? Yes, I'm taking a new medication. You write down, patient no longer, or patient now taking X, goes on the ATC form with today's date. So this is where you are updating this whole health history. So any changes go on this part. Okay? So you cannot do it. So initial appointments, subsequent appointments, perio maintenance appointment. Changes in health status are completely full or over 3 years. Okay? Again, I can't stress enough that this is a legal document. I can guarantee you when the college was sued for the patient bleeding, did you think they subpoenaed the health history? Yes, they can subpoena. Is it HIPAA involved? Not when you're in a court case, right? They will treat it. They will figure out how to handle that information. But they want to know, did you know that this patient had this condition? And you treated them anyway. The big problem in legality in treating clients has nothing to do with you making an honest mistake. It has everything to do with you not following through or covering up a mistake. If you make an honest mistake, it happens. Honest mistake happens. Always look at your health history. I can tell you at least one time in my career where I did not check the health history, and it was a disaster. Well, luckily it wasn't a disaster, but I had a heart attack afterwards because I was like, holy moly, I really was lucky. I had a patient way back in the dark ages. I have no idea why I didn't check his health history. It probably had something to be with me behind schedule. I'd seen him, I don't know, I can't even remember why I didn't check it. It's just, I'm sure there were things going on that I didn't check it. It was a rough day at the office, who knows. And I picked up an ultrasonic scaler and cleaned the mandibular anterior teeth, and after his appointment, he had a pacemaker. And back then, they were unshielded pacemakers. Holy moly. I could have had a dead patient or some disaster happening in my office. Luckily, it didn't. I have no idea why it didn't happen, but it didn't. So you need to read your health histories. You may not luck out like I did. Okay. All right. I think I've told this. If you have a correction, you put a wrong date, you all know one line and initial. You do not scribble. Okay? So you put no changes. Because you're thinking the patient has no changes. You just saw him on Tuesday and it's Thursday. Patient comes in, I've changed my medication. You've already written this. You shouldn't have, but you already did, right? So you do one line and initial it. Why do we do one line? We can still read it because we want to know what you are changing. If you white out, black it out, scribble it out so we can't read it, and there's some kind of legal case, they're going to assume the worst. So one line initial, any changes, because we're making you do it in ink. You can't erase it. So one line, initial it. All of your corrections that are done in ink, that's what I want to see. Everywhere. Okay? Now, our T&P notes we can type so we can make changes, so that's good. All right, so clients usually sign it, okay, and then they sign under the health status. If you have a client that's a minor, and we'll talk about these later, the mom would obviously sign it. We never give the original record to the client. If a client needs the record for whatever reason, we'll make copies. So never give any of our original forms to the client. We need to have those. No blank spaces, okay? So, I'm looking. So this health history, and if it's okay with you, this health history has a regular physician, and it's filled in there, but this person does not have a specialist. because some people have cardiologists. So it's blank. Makes sense. It should be blank. She doesn't have a specialist. You put NA in that blank space. And the reason you do is that tells me you asked the client. If it's empty space, I have no idea whether you asked that question to the client or not. So anything that does not pertain to them, any blank space. Now here, this answers their question because they said, no, I'm not taking any of these. You don't have to put NA there because the answer is no. But any blank space on your health history, you need to write NA. Otherwise, and this is the area everybody leaves out. A lot of our patients do not have physicians. And so everybody leaves that blank. Put NA in there because you're asked them, do you have a physician? Do you have a specialist? So NA, yes. Yes. Because I could answer that no, because I just see my physician for routine physicals. I don't feel like I'm under the care of a physician. That's how I would answer, no, I'm not under the care. I'm not seeing my physician for anything in particular. I just go in for a routine physical once every 40 years. So that doesn't work. Okay? Or I could have an orthopedist because I broke my finger.
Yeah, no, I just think like the way it's phrased, it's 3 and then if yes, answer these questions. Does that make sense?
Yes, it makes sense.
Okay. So like
but it does not make sense because it says right here, oh, if yes, what are the conditions you're being treated for? You know, some people will write routine physicals. You know, well then you know they have a physician. But the people that don't have a physician, you know, they're going to say, no, I'm not under the care of a physician. And like I said, I might answer it that I'm not under the care for that one reason. Okay? All right. We don't take any financial information. All you need to know is $10, right? We don't file insurance. We don't take their social security number. We don't take any of that business, okay? That's different from offices, okay? Black ink only. You should know these categories. You won't be responsible for them, filling them out, but this kind of is also something that comes on our A form when we talk about grading. We have to identify the ASA categories. This is from the American Society of Anesthesiologists. ASA 1 is a relatively healthy patient, but ASA 2, you could have a cold, you could be anxious, you could be pregnant. That's at 2, okay? ASA 3 is you would have severe systemic disease. Hopefully you're not seeing any 4s or 5s, okay, because they're threat to life, and 6s. We won't be seeing any 6s, I hope, okay? Okay, we're going to skip this. You guys are excited about that I'm skipping it all. Okay, so I have like 10 minutes to tell you everything. All right, so demographic information. Unfortunately, we have 2 places we're going to put this information. EagleSoft, and we're also going to put it in our health history. You can mail these to the clients, and we'll talk about that when we're planning for appointments. They can fill it all out, and then they hopefully mail it back or bring it back with them. Okay, so demographic history goes here. This is important that they have emergency contact in case they go unconscious on us. We have that information that we can call their next of kin, okay? So we want to have that. Now, in regular offices, we do it for insurance information. Birth dates are super important, especially in EagleSoft. We have people with the same name, and the only way father and a son, they may not be junior, they may not be second. You fill out the same name in a chart, okay? So you have to put the birth date in. Always check in EagleSoft, always check to see if the patient is in our database. I actually did a patient last year, Clinic 3. Student told me she was a new patient. I came in. I said, okay. She said, oh, yeah, I'm a new patient. We filled out a new chart in EagleSoft. Ms. Stabby came to see me at 11:30. You have duplicate charts. What? No, I don't. New patient. Oh, new patient. Nope, duplicate charts. Why the patient told us she was a new patient, I have no idea. Before you put any patient into EagleSoft, you put their name in and look at the database. Do not assume they're not in EagleSoft, okay? That is primary rule for demographic information. You check to see if they're in there. Okay, We can edit existing information in EagleSoft. When you're looking for your patient, gosh, I don't know. Here it is. I have it. Woohoo! Okay. So here's where all their demographic information goes. It will default to female. So if you have a male patient, make sure you click male, because I've seen a lot of funny females named George and Michael and all those names, okay? So make sure you move that over to male. The birthday is important. We don't care about the social. Obviously, their dress is important, because that may tell us who's different and who's not, but they could have moved, right? So the most important thing is their birthday. We do not fill out anything in the center part, okay? We will be filling out this, and I'll tell you about that later. This is what we're doing today. So you go into when I give you your assignment, you will go into your bogus patient. You will pull up their registration form. So you go to the patient list. You hit edit. That will pull up the registration form. You click alerts, and I'd really like to show you how to do this. You click alerts, and a box comes up on one side, and a box comes up on the other side, and you scroll down and find what are the medical alerts that you found off this health history, and you move them over to their alert box. Okay, so it's double-sided. 2 boxes, big list. You guys have done that before. Sorry, this is rushed, people. We'll pick up on Thursday what I don't get, but you have to do this in your assignment today. So the alerts box in EagleSoft. This box will have the big long list of all the alerts. It'll have move over, and you put all the lists there and save it. So every time we click on that patient, those alerts will come up, what that patient has. So we know in EagleSoft. It'll remind us. That's where you find it. Make note, okay? Because when you do this assignment in clinic, I do not want you to do it as a team. I want you to do it on your own. So if you're the partner, just sit in the chair and relax and zen out and breathe, okay? Let the person do their alerts, okay? All right. We do have a chief concern or complaint that we will be filling out on our A forms and in our T&P notes. We have all of this for our health history to help us, their past history, what kind of brushing they do. This is pretty self-explanatory. Moving on, okay, all explanatory. Why did I put it in my slides? I'm not sure. Okay, the medical consult form, Kristen gave us a nice review of that. Section 4, page 13, will give you what we're going to have to send a medical consult for. Some people need to be pre-medicated prior to us seeing them. Okay? So we will send out a medical consult to see if we can treat them. So then that doesn't necessarily mean that they will be dismissed from the clinic, but sometimes it can mean. They'll get there and we dismiss them, like their blood pressure is too high. We will not see them if they're out of the parameters. Okay. We can give antibiotics to patients that need them in clinic. So say they need to be pre-medicated, we can give them some in clinic. But you have to go through doctor to do that. Can he write a script for your patient coming in next week? Yes. Our doctors on Monday and Wednesday, you just go say, hi, I'm a Clinic 2 student. I need a script for pre-medication for a total joint replacement. And they will write you a script. You should come with the pharmacy that the patient, you should bring the patient's health history with you so they know who they're writing the script for. So our doctors can do that. We would prefer not to dispense this from clinic because obviously we're paying for that medication, but to facilitate you with your treatments, we'll do it. If they have to be pre-medicated, it's a good idea to leave 10 days in between their appointments so their body has a chance to readjust. It doesn't, what do I want to say? It doesn't become used to the antibiotic and it no longer works. So on patients we're pre-medicating, it's important for you to get as much done as possible, right? You don't want to pre-medicate them and not get any scaling done if you can. There's joint replacements. We do not routinely pre-medicate them. We do not pre-medicate heart murmurs. Those of you that have been out in private practice, if I graduated with anything from my school, it was to pre-medicate every heart murmur that walked in the door. But you do not anymore. It depends on the heart murmur. So there are certain conditions we pre-medicate and certain ones we don't. If they have a chemo port or a PICC line, we almost always pre-medicate those patients. So it is in your clinic manual, okay? Again, Ms. Stabby said on the anticoagulant therapy, they need to have their INR number. 2 to 3 is what we want within 24 hours to 2 days. Some people may not want to go in and get it checked so you can see it's a problem. So we have antiplatelet agents. Do we take them off the warfarin to treat them? No, because they're on it for a bigger reason than us. But we check to see if there are patients that we can treat in our clinic. Okay, so vasoconstrictors in our anesthetic, so we have to pay attention to those drugs. Diabetes, we want to make sure they're controlled. And also there's drugs we want to limit during pregnancy and breastfeeding as well for our patients. So the health history is really, really important for you to study over so you know your patient, right? And then there's a nice section on, I actually got a patient on his second visit, and it was really great. The patient could not get a kidney transplant until he got his teeth cleaned. And nobody would clean his teeth because he had no money. And the student found him at one of our extended campus sites and told him to come into clinic, which was great. He did have $10. So we were cleaning his teeth so he could get a kidney transplant. I got him on the second appointment, and the student, or the third appointment, and I looked over his health history, and he was doing his dialysis in the morning and his cleaning appointment in the afternoon. No, you don't want to be doing that. And and I'm like, okay, I'm sorry, we have to stop this appointment. Yes, I know we saw you last week or whenever he had it, but I told him all the reasons why you wouldn't do that, and that's a problem. So another instructor had approved that, right? Again, it wasn't me, thank goodness, right? So we're trying to be on top of it, but you have to be on top of it too. And for the next 2 years, you're lucky because we'll be there to help you, okay? All right, health history and EagleSoft. Okay, we have the health alerts you're going to do in EagleSoft. TMP notes are going to start on Tuesday on our practice client. We will have time, hopefully on Thursday, to go over what we're going to write in those. Medical emergencies assignment. I posted the sign-up sheet. It's a group assignment, 3 to a group, except for syncope, that's 2. Their health histories are in my mailbox. You are to review their health histories, and there's a criteria for your emergencies on D2L, and there's a scenario. And it's a simulation. It's not a report. It's not an oral report. You come up here and show us what you do in your emergency. The patient has the emergency. Panic, okay? You can do a video in clinic, and as long as the video plays in class, it's acceptable. We'll talk about these a little bit later, but I want to see what I have on my clinical update, if anything. Emergencies. Okay. Okay. Thursday, blood pressure equipment. We have an interview assignment in clinic today. Sign up for your group projects. I am going to have you do a little hunt around clinic for the emergency supplies that you would need for your simulation. Check with the Monday and the Wednesday doctors when they're not busy. Just pop in there and say, hi, I'm a pre-clinic student. I'm working on my emergency. Do we have these things? Don't come in there and say, I'm doing syncope. What do I do? You come in after you research and say, does our clinic have this? And do we use them, and where are they? Because that's going to be part of your assignment. Whew. I'm exhausted. Take the rest of the day off. No. All right, any last questions on health history? We will review it a little bit more on Thursday. Carol, do I still have yours? Thank you very, very much. Okay, see you in clinic.